Welcome, future nurses. You have officially made it to day 22 of our unstoppable 30-day NCLEX challenge. And if no one has reminded you lately, let me be the one to say it. You are doing an incredible job. That is right. You are now just 8 days away from completing all 30 full-length NCLEX practice tests. And by now, you have already tackled over 1,400 high-yield exam-level questions. But before we dive into practice test 22, I have something exciting to share. For a limited time, you can grab free 5-day access to our complete NCLEX crash course. No payment, no credit card, no strings attached. All you have to do is click the WhatsApp link in the description and send the word "Hi." That is it. Our team will immediately enroll you and unlock live and recorded NCLEX review sessions, next-gen NCLEX case studies and walkthroughs, over 5,000 real NCLEX-style questions, PDF notes, expert help, and strategy guides, customized 7-day and 30-day study plans, all for free. This is your moment to level up, target your weak areas, and lock in your final NCLEX game plan. And yes, it is all completely free for 5 days, just for being part of this challenge. Let us begin practice test 22 with a critical care. Question 1. A nurse is reviewing arterial blood gas values for a client with acute respiratory failure. Which ABG result reflects the expected acid-base imbalance? Here are the options. Option A, pH is 7.29, partial pressure of carbon dioxide is 56 millimeters of mercury, partial pressure of oxygen is 83 millimeters of mercury, and bicarbonate is 22 milliequivalents per liter. Option B, pH is 7.38, partial pressure of carbon dioxide is 40 millimeters of mercury, partial pressure of oxygen is 92 millimeters of mercury, and bicarbonate is 25 milliequivalents per liter. Option C, pH is 7.49, partial pressure of carbon dioxide is 30 millimeters of mercury, partial pressure of oxygen is 96 millimeters of mercury, and bicarbonate is 28 milliequivalents per liter. Option D, pH is 7.50, partial pressure of carbon dioxide is 44 millimeters of mercury, partial pressure of oxygen is 93 millimeters of mercury, and bicarbonate is 34 milliequivalents per liter. The correct answer is option A, which shows respiratory acidosis, a common finding in acute respiratory failure caused by hypoventilation. The low pH and high carbon dioxide confirm a respiratory problem, and the normal bicarbonate suggests it is still uncompensated. For NCLEX success, remember, respiratory acidosis means low pH and high PaCO2, and in acute cases, compensation may not be present. Always interpret pH, PaCO2, and HCO3- together for a complete picture. Now let us move to question 2, which focuses on a critical emergency scenario. A client presents with a slow respiratory rate, pinpoint pupils, slurred speech, low blood pressure, and altered consciousness. Based on these findings, which condition should the nurse suspect? Here are the options. A. Acute alcohol intoxication. B. Alcohol withdrawal syndrome. C. Cocaine toxicity. D. Opioid overdose. The correct answer is option D, opioid overdose. The combination of bradypnea, meiosis, hypotension, and sedation strongly suggests opioid toxicity. These signs result from central nervous system depression, and immediate administration of naloxone is critical to reverse the effects and support breathing. For NCLEX success, remember this triad: pinpoint pupils, respiratory depression, and altered consciousness equals opioid overdose. Act fast and always check for airway and breathing first. Now on to question 3. A client with a history of atrial fibrillation arrives at the emergency department with a heart rate of 126 beats per minute. Which action should the nurse prioritize? Here are the options. A. Request an order for a bolus of isotonic intravenous fluids. B. Encourage the client to attempt a Valsalva maneuver. C. Evaluate the client for chest discomfort or signs of ischemia. D. Initiate preparation for immediate synchronized cardioversion. The correct answer is option C. Evaluate the client for chest discomfort or signs of ischemia. A heart rate this high in atrial fibrillation indicates rapid ventricular response, which may reduce cardiac output and cause ischemia. The nurse must first assess for symptoms like chest pain or hypotension to guide next steps. NCLEX tip: in atrial fibrillation with a fast rate, check symptoms before choosing treatment. Assessment always comes before action. Let us continue with question 4, which focuses on home safety with oxygen therapy. A client with chronic obstructive pulmonary disease is being discharged with a new prescription for home oxygen. What teaching point should the nurse emphasize to ensure safety? Here are the options. A. Tuck the oxygen tubing securely beneath blankets or bed linens. B. Apply petroleum-based products to prevent facial dryness near the cannula. C. Refrain from smoking while the oxygen is in use. D. Set the oxygen flow to the maximum level to enhance breathing. The correct answer is option C. Refrain from smoking while the oxygen is in use. Although oxygen is not flammable, it greatly accelerates combustion, making smoking near oxygen extremely hazardous. Even a small spark can lead to serious injury or fire. For NCLEX success, remember, no smoking, no petroleum products, and no unsupervised oxygen adjustments when teaching home oxygen safety. Now, let us move on to question 5, which addresses pediatric understanding of death during end-of-life care. You are caring for a 33-year-old father who is nearing death. He has a 14-year-old son and an 8-year-old daughter. As both children are being prepared for their father's passing, what key factor should the nurse consider when explaining the concept of death? Here are the options. A. Children younger than 12 find death terrifying. Therefore, the nurse should avoid discussing it with them. B. Children under 12 have no real understanding of death or its finality. C. A child's cognitive development significantly influences how they perceive and understand death. D. Cognitive development has no influence on how children under 12 comprehend death. The correct answer is option C. A child's cognitive development significantly influences how they perceive and understand death. A child's age and developmental stage shape how they view death. Preschoolers may see it as reversible, while school-aged children begin to grasp its finality. Tailoring conversations to each child's level of understanding is essential for emotional support. NCLEX tip: always match your explanation of death to the child's developmental level and involve the family in creating a supportive environment. Hold on, future nurse. I have something exciting to share. If you are serious about passing the NCLEX, then this is your golden opportunity. For a limited time, you can grab free 5-day access to our complete NCLEX crash course. And no, you do not need to pay, enter a credit card, or commit to anything. Just click the WhatsApp link in the description and type the word "Hi." That is it. Once you do, our team will instantly enroll you and unlock live and recorded NCLEX review classes you can watch anytime. Next-Gen NCLEX, NGN case studies with step-by-step walkthroughs. Over 5,000 real NCLEX-style questions to sharpen your test skills, PDF notes, strategy guides, and support from expert educators. And your choice of a custom 7-day or 30-day study plan? Totally free. This is your chance to level up, crush your weak areas, and go into the NCLEX with total confidence. So do not miss it. Hit that WhatsApp link and let us get you started. Now, back to the test. Let us keep going. Let us move to question 6, which focuses on transfusion therapy in a critical care setting. A client diagnosed with disseminated intravascular coagulation is prescribed fresh frozen plasma. What is the primary therapeutic goal of administering FFP in this scenario? Here are the options. A. To increase the client's platelet count. B. To restore electrolyte balance. C. To replace depleted coagulation factors. D. To stimulate red blood cell production. The correct answer is option C. To replace depleted coagulation factors. In disseminated intravascular coagulation, clotting factors are rapidly consumed, leading to both clotting and bleeding. FFP provides essential clotting proteins like fibrinogen and prothrombin, helping to restore hemostasis and reduce bleeding risk. NCLEX, Pearl. In DIC, FFP supports coagulation, not platelets or red cells. Always match the blood product to the clinical goal. Let us take a closer look at question 7, which highlights safe nursing practices in acute abdominal pain. A client with suspected appendicitis is experiencing discomfort. Which non-pharmacological intervention would be contraindicated for pain relief in this case? Here are the options. A. Applying a cold compress to the abdomen. B. Guiding the client through relaxation breathing exercises. C. Placing a heating pad over the abdomen. D. Encouraging the client to remain at rest. The correct answer is option C. Placing a heating pad over the abdomen. Applying heat can increase blood flow and worsen inflammation, which may lead to rupture of the appendix and life-threatening peritonitis. Heat is strictly avoided in suspected appendicitis. NCLEX. Tip. In suspected appendicitis, avoid heat, encourage rest, use cold if needed, and prepare for possible surgery. Let us now turn to question 8, which focuses on diagnostic imaging related to renal function. The nurse is preparing a client for a scheduled renal ultrasound. Which statement best explains the purpose of this diagnostic procedure? Here are the options. A. To assess the levels of potassium and sodium in the bloodstream. B. To determine the kidney's ability to stimulate red blood cell production. C. To visualize the kidney's size, structure, position, and assess renal blood flow. D. To detect the amount of urea circulating in the client's blood. The correct answer is option C. To visualize the kidney's size, structure, position, and assess renal blood flow. A renal ultrasound is a non-invasive test used to examine kidney anatomy and circulation. It helps detect abnormalities like tumors, cysts, hydronephrosis, and blood flow issues, without involving radiation. NCLEX. Tip. Renal ultrasound equals structural and vascular assessment, not chemical or hormonal function. Always know which diagnostic test matches the clinical goal. Let us continue with question 9, which highlights effective pain assessment in hospice care. A client with cancer-related bone metastases reports acute discomfort. What is the most reliable method for evaluating this client's pain level? Here are the options. A. Monitor vital signs after administering analgesics. B. Observe the client's facial expressions and behaviors. C. Interpret both spoken complaints and nonverbal gestures. D. Ask the client to rate their pain using a 0 to 10 numeric scale. The correct answer is option D. Ask the client to rate their pain using a 0 to 10 numeric scale. Pain is subjective, and a standardized tool like the numeric rating scale offers the most accurate way to assess intensity. The client self-report remains the gold standard in pain management, especially in hospice care where comfort is the priority. NCLEX. Tip. When clients can verbalize pain, always prioritize their self-report using a valid pain scale. This guides treatment and ensures quality care. Let us move into question 10, which centers on poison safety education for parents. During a school-led session, a nurse discusses emergency responses to childhood poison exposure. Which parent statement indicates a need for further teaching? Here are the options. A. We always label bottles that contain dangerous household liquids to avoid confusion. B. If my child swallows gasoline, I should try to make them vomit to get it out. C. If my child accidentally drinks a strong household chemical, I can give them a little milk or water while I rush them to the emergency department. D. All hazardous substances in our home are locked and stored well out of our child's reach. The correct answer is option B. If my child swallows gasoline, I should try to make them vomit to get it out. Inducing vomiting after gasoline or hydrocarbon ingestion is dangerous and increases the risk of aspiration and chemical pneumonia. Parents should be taught to call poison control and seek immediate emergency help. Never induce vomiting in such cases. NCLEX. Tip. Never induce vomiting after hydrocarbon ingestion. Call poison control immediately and follow professional guidance. Let us move forward to question 11, which focuses on immediate care for a client in acute mania. A client diagnosed with bipolar disorder is currently experiencing a manic episode. Which nursing intervention should take priority at this time? Here are the options. A. Arrange structured individual activities to minimize stimulation. B. Use redirection to help the client stay focused during conversations. C. Offer small, frequent meals that are high in calories and easy to consume. D. Request a psychiatry consultation for long-term treatment planning. The correct answer is option C. Offer small, frequent meals that are high in calories and easy to consume. During mania, clients are often too distracted to eat, putting them at risk for nutritional deficits. Providing high-calorie, portable foods addresses their immediate physiological need, which takes top priority in the acute phase. NCLEX. Tip. In mania, basic needs like food and fluids must be addressed first. They come before communication or long-term interventions. Next up is question 12, which focuses on medication safety in Alzheimer's disease management. A client is prescribed donepezil as part of their treatment plan. Which parameters should the nurse prioritize monitoring throughout the course of therapy? Here are the options. A. Heart rate. B. Fasting, blood glucose. C. Total cholesterol level. D. Oxygen saturation. The correct answer is option A, heart rate. Donepezil increases acetylcholine, which enhances parasympathetic tone and may lead to bradycardia. This can result in dizziness, fatigue, or falls, especially in older adults or clients on cardiac medications. Monitoring pulse regularly is essential for early detection and prevention of complications. NCLEX tip: donepezil equals think bradycardia. Always check the pulse, especially in elderly clients or those with cardiac histories. Let us now shift to question 13, which focuses on appropriate delegation in a surgical care setting. The nurse is assigning tasks to team members on a surgical floor. Which of the following duties is most appropriate to delegate to an unlicensed assistive personnel? Here are the options. A. Assist with the first ambulation of a client following laparoscopic hernia surgery. B. Feed a client who has difficulty swallowing due to dysphagia. C. Apply sequential compression devices to a client's legs for venous thromboembolism prevention. D. Call in discharge prescriptions to the client's pharmacy. The correct answer is option C. Apply sequential compression devices to a client's legs for venous thromboembolism prevention. This is a routine, low-risk task that does not require clinical judgment, making it safe to assign to a UAP under RN supervision. NCLEX tip: UAPs can perform non-complex, stable tasks. Never delegate assessments, teaching, or any activity requiring clinical decision-making. Let us now move to question 14, which highlights the critical initial priorities in managing an eating disorder. A client newly diagnosed with anorexia nervosa is admitted to the behavioral health unit. Which assessment should the nurse prioritize during the initial phase of care? Here are the options. A. Evaluating the client's stress management and coping mechanisms. B. Monitoring the client's serum electrolyte levels closely. C. Tracking the client's current weight and weight trends. D. Reviewing the client's food preferences for meal planning. The correct answer is option B. Monitoring the client's serum electrolyte levels closely. Clients with anorexia nervosa are at high risk for life-threatening electrolyte imbalances, such as low potassium, sodium, or phosphate. These can lead to dangerous cardiac arrhythmias, making electrolyte monitoring the top priority for survival. NCLEX tip: in eating disorders, always stabilize physical health first. Electrolyte monitoring and cardiac safety come before psychological care. Now, let us move to question 15, which focuses on proper neurological assessment of visual reflexes. During a routine physical exam, the nurse evaluates a client's eyes for accommodation. Which action correctly demonstrates how to assess this reflex? Here are the options. A. Shine a penlight briefly into the client's pupil from the lateral side of the face. B. Instruct the client to first focus on a distant object, and then on an object held near their face. C. Place a vibrating tuning fork at the center of the client's forehead to assess vibration sensation. D. Ask the client to read from a Snellen eye chart positioned 20 feet away. The correct answer is option B. Instruct the client to first focus on a distant object and then on an object held near their face. This tests the accommodation reflex, which evaluates the eye's ability to adjust focus, involving pupil constriction and convergence as the eyes shift from far to near vision, controlled by the oculomotor nerve. NCLEX tip: accommodation equals near focus plus pupil constriction plus eye convergence, a key part of documenting normal PIRLA. Quick timeout, because you deserve to know this. For a limited time, you can get free 5-day access to our complete NCLEX crash course. No payment, no catch. Just click the WhatsApp link in the description and send the word "Hi." You will unlock instant access to live and recorded NCLEX review classes, next-gen case studies, 5,000 plus real NCLEX-style questions, expert guidance, and checkmark tailored study plans to fit your timeline. This is your shortcut to clarity, confidence, and crushing the NCLEX. Do not miss out. Let us take a closer look at question 16, which focuses on disaster classification in healthcare settings. The nurse is reviewing internal disaster protocols and must identify which situation qualifies as an internal disaster. Here are the options. A. Complete loss of water supply within the hospital facility. B. Excessive patient volume causing delays in the emergency department. C. Multiple casualties from a mass shooting incident at a nearby concert venue. D. Unavailability of opioid medications in the post-operative recovery unit. The correct answer is option A. Complete loss of water supply within the hospital facility. This is a clear example of an internal disaster, as it directly disrupts infection control, sanitation, and basic facility functions, putting both patients and staff at risk. NCLEX tip: internal disasters originate within the facility and affect infrastructure. Always distinguish these from external events that bring patients in from outside. Let us shift to question 17, which centers on safe and effective management of diabetic ketoacidosis. A nurse is preparing educational material for a staff training session on DKA. Which teaching point should be emphasized? Here are the options. A. Blood glucose levels should be reduced gradually, targeting a decrease of 50 to 75 milligrams per deciliter per hour. B. Dextrose 5% in water, D5W, should be kept at the bedside in case hypoglycemia develops. C. Hypovolemia associated with DKA is best managed using hypertonic saline, 3% sodium chloride. D. Urine output will typically increase once intravenous insulin therapy is started. The correct answer is option A. Blood glucose levels should be reduced gradually, targeting a decrease of 50 to 75 milligrams per deciliter per hour. Rapid glucose correction increases the risk of cerebral edema, especially in pediatric clients. Controlled insulin infusion helps safely bring down glucose and ketone levels. NCLEX tip: in DKA, treat with fluids first, insulin second, and monitor potassium. And always reduce blood sugar gradually to avoid complications. Let us move on to question 18, which focuses on age-related changes in the integumentary system. During a comprehensive physical assessment of an older adult, the nurse evaluates the client's skin, hair, and nails. Which of the following findings would the nurse identify as a normal change related to aging? Here are the options. A. Skin that appears consistently moist and supple. B. Noticeably faster nail growth on fingers and toes. C. Dry, flaky skin accompanied by occasional itching. D. Diffuse darkening and thickening of skin pigmentation throughout the body. The correct answer is option C. Dry, flaky skin accompanied by occasional itching. This condition, known as xerosis, is common in older adults due to reduced sebaceous activity, thinning skin, and decreased hydration, making dryness and itching a normal age-related change. NCLEX tip: in older adults, dry skin, slower nail growth, and reduced sweat production are expected. Always distinguish these from signs of underlying disease. Now, let us review question 19, which focuses on safe medication practices for clients with kidney disease. A nurse preceptor is observing a newly hired nurse caring for a client with advanced polycystic kidney disease. Which action should prompt the preceptor to intervene? Here are the options. A. Requests a provider order for ketorolac to help manage the client's flank pain. B. Teaches the client how to use guided imagery to promote comfort. C. Applies dry heat to the client's abdomen to alleviate discomfort. D. Offers the client meals that are high in fiber and low in sodium. The correct answer is option A. Requests a provider order for ketorolac to help manage the client's flank pain. Ketorolac is a non-steroidal anti-inflammatory drug that can worsen renal perfusion and should be avoided in advanced kidney disease due to its nephrotoxic potential. NCLEX tip: in clients with kidney disease, avoid NSAIDs like ketorolac. Always choose kidney-safe comfort strategies and monitor renal function closely. Let us move on to question 20, which highlights appropriate delegation practices on a medical surgical unit. A nurse manager is reviewing tasks assigned to unlicensed assistive personnel. Which delegated task should prompt the nurse manager to intervene? Here are the options. A. Assisting with perineal hygiene for a client who has an indwelling urinary catheter. B. Performing passive range of motion exercises for a client with reduced mobility. C. Reminding a client how to manage care for a long-term colostomy. D. Ambulating a client using a gait belt for stability and safety. The correct answer is option C. Reminding a client how to manage care for a long-term colostomy. Teaching and reinforcing client education, even if it is review, requires clinical judgment and must be done by a licensed nurse. This exceeds the UAP's scope and should be addressed by the nurse manager. NCLEX tip: UAPs can perform basic care but cannot teach, assess, or evaluate. Always reserve those responsibilities for licensed nurses. Let us now examine question 21, which addresses the initial nursing response to suspected abuse. A client arrives at the emergency department with visible bruises and burns and discloses that her spouse caused the injuries during a domestic dispute. What is the nurse's initial priority action? Here are the options. A. Perform a thorough assessment and initiate treatment of physical injuries. B. Coordinate with the social worker for safe discharge planning. C. Begin building a therapeutic relationship with the client. D. File a report with the appropriate authorities to document the abuse. The correct answer is option A. Perform a thorough assessment and initiate treatment of physical injuries. In line with Maslow's hierarchy of needs, the nurse must first ensure physiological safety by assessing and treating any physical trauma, pain, or complications before addressing psychosocial or legal concerns. NCLEX tip: in cases of abuse or trauma, treat physical injuries first, then proceed with emotional support, safety planning, and mandatory reporting. Let us take a look at question 22, which highlights key prenatal diagnostic procedures discussed in prenatal education. While teaching expectant clients, the nurse shares information about common tests. Which of the following statements should the nurse include as accurate? Here are the options. A. Chorionic villus sampling can help detect neural tube defects early in pregnancy. B. The maternal serum alpha-fetoprotein test can reveal the baby's gender. C. Amniocentesis can be used to identify chromosomal abnormalities in the fetus. D. The biophysical profile evaluates 6 fetal characteristics, including glucose levels. The correct answer is option C. Amniocentesis can be used to identify chromosomal abnormalities in the fetus. This procedure, typically done between 15 and 20 weeks of gestation, analyzes amniotic fluid, which contains fetal cells that can reveal chromosomal disorders, neural tube defects, and fetal lung maturity. NCLEX tip: know what each prenatal test measures and when it is done, especially differences between amniocentesis, CVS, MSAFP, and BPP. Let us now move to question 23, which focuses on interdisciplinary collaboration for post-surgical recovery. A nurse is caring for a client recovering from hip surgery who will need to climb stairs to access their bedroom after discharge. To help the client regain strength and mobility for this task, the nurse should recommend a referral to which healthcare professional? Here are the options. A. Physical therapist, PT. B. Nutritionist. C. Case manager. D. Occupational therapist, OT. The correct answer is option A. Physical therapist, PT. A physical therapist specializes in restoring mobility, balance, and strength, especially for tasks like stair climbing, and creates targeted rehabilitation plans to support safe movement after surgery. Option B is incorrect because nutritionists support dietary needs, not physical rehab. Option C is incorrect since case managers coordinate services but do not directly provide strength or mobility training. Option D is incorrect because occupational therapists focus on daily activities like dressing and grooming, not large muscle movement like stair climbing. NCLEX tip: refer to physical therapy for mobility and strengthening goals, especially after orthopedic surgeries that affect walking and balance. Let us focus now on question 24, which addresses acute medication management for a pediatric cardiac emergency. A nurse is caring for a child with tetralogy of Fallot who is experiencing frequent hypercyanotic, or TET spells. Which medication should the nurse expect the provider to prescribe for managing these episodes? Here are the options. Amorphine. B. Furosemide. C. Enalapril. D. Formoterol. The correct answer is option A. Morphine. Morphine helps calm the child, reduce oxygen demand, and relieve infundibular spasm, improving pulmonary blood flow and systemic oxygenation during TET spells. Option B is incorrect because furosemide reduces preload and can worsen perfusion in this situation. Option C is incorrect since enalapril lowers systemic vascular resistance, increasing right-to-left shunting and worsening hypoxia. Option D is incorrect because formoterol raises heart rate and oxygen demand, potentially intensifying the cyanotic episode. NCLEX tip: in tetralogy of Fallot, manage TET spells with morphine, knee chest positioning, oxygen, and fluids. Never reduce systemic vascular resistance during these episodes. Let us now turn to question 25, which addresses safe medication education for a client with hyperthyroidism. A nurse is providing discharge instructions to a client prescribed propylthiouracil, or PTU. Which client statement shows correct understanding of this medication? Here are the options. A. I will start adding more iodine-rich foods to my diet to support thyroid function. B. I should expect my urine to turn reddish while taking this medication. C. My liver enzymes will need to be checked regularly while I'm on this drug. D. If this medication is working, I should begin to lose more weight. The correct answer is option C. My liver enzymes will need to be checked regularly while I am on this drug. PTU carries a risk of liver toxicity, and regular monitoring of liver function tests is essential to detect early signs of hepatic injury. NCLEX tip: with PTU, monitor liver function closely, avoid iodine-rich foods, and teach clients to report signs of liver trouble such as jaundice or dark urine. Hey, real quick, before we go any further, I have a little gift for you. Our team is giving away 5 days of free access to the complete NCLEX crash course. No strings, no card, just value. All you have to do is click the WhatsApp link below and say, "Hi." We will instantly unlock all access to NCLEX live and replay classes, 5,000 plus NCLEX-style practice questions, check expert help, notes, and strategies, and your custom prep plan 1 week or 1 month. Trust me, this is the kind of help that makes all the difference. Let us now shift our focus to a pediatric infectious disease scenario for question 26. A nurse is preparing the care plan for a child admitted with Impetigo. What type of isolation precaution is most appropriate to prevent transmission? Here are the options. A. Standard precautions. B. Contact precautions. C. Droplet precautions. D. Airborne precautions. The correct answer is option B, contact precautions. Impetigo is a contagious skin infection typically caused by Staphylococcus aureus or Streptococcus pyogenes. It spreads through direct skin contact or contaminated items, which makes contact precautions, including gloves, gown, and hand hygiene, absolutely necessary. These precautions should continue until lesions have dried and crusted over. Quick NCLEX reminder: for any skin infection that is wet, weeping, or contagious, such as Impetigo, MRSA, or scabies, always implement contact precautions to protect others and prevent spread. Let us move into another important medication safety scenario with question 27. A nurse is reviewing instructions with a client who is starting dulaglutide therapy for type 2 diabetes mellitus. Which client statement indicates a need for further clarification? Here are the options. A. If I begin experiencing vomiting and upper abdominal pain, I should inform my healthcare provider. B. I need to inject this medication within 1 hour of eating my meals. C. A drop in my hemoglobin. A1C levels will mean the medication is helping. D. I will take this medication once every week. The correct answer is option B. I need to inject this medication within 1 hour of eating my meals. Dulaglutide is a long-acting GLP-1 receptor agonist given once weekly and is not tied to meal timing. It provides steady glucose control, so injecting it around meals is unnecessary and shows a misunderstanding. NCLEX clinical pearls. Dulaglutide does not require meal coordination and helps lower blood glucose by enhancing insulin release. Monitor for signs of pancreatitis and avoid in clients with thyroid cancer history. Its long-acting nature supports weekly dosing and promotes weight loss. Let us now focus on question 28, which highlights prioritization in a client with a balance-related disorder. A client has been hospitalized due to a worsening episode of Meniere's disease. While developing the plan of care, which nursing action should be given top priority? Here are the options. A. Assess the extent of the client's hearing loss. B. Implement safety precautions to prevent falls. C. Reinforce the need for sodium restriction in the client's diet. D. Administer prescribed medications such as anticholinergics and antiemetics. The correct answer is option B. Implement safety precautions to prevent falls. During acute Meniere's episodes, severe vertigo significantly raises fall risk. Preventing injury is the top priority, making safety interventions like using bed alarms, assisting with ambulation, and ensuring a safe environment essential. NCLEX clinical pearls. Meniere's disease causes vertigo, tinnitus, and hearing loss. During flare-ups, fall prevention is the immediate priority. Long-term management includes a low-sodium diet, lifestyle modifications, and symptom control medications like meclizine or diuretics. Educate clients to avoid caffeine, alcohol, and smoking. Now, the next question, 29. The healthcare provider has prescribed 375 micrograms, which is the same as 0.375 milligrams, of digoxin to be given intravenously to a client. The vial of digoxin available to the nurse is labeled as 0.25 milligrams per milliliter. How many milliliters should the nurse administer to deliver the prescribed dose? Write your answer using 1 decimal place. Correct. Answer is 1.5 milliliters. To determine how much volume in milliliters the nurse should administer, divide the amount of medication prescribed by the concentration available in the vial. So 0.375 milligrams divided by 0.25 milligrams per milliliter equals 1.5 milliliters. Therefore, the nurse should draw up and administer 1.5 milliliters of digoxin to deliver the correct dose. Let us now move to our next dosage calculation question that focuses on insulin infusion. Question 30. The healthcare provider has ordered a continuous intravenous infusion of regular insulin to be given at a rate of 4.5 units per hour. The insulin solution available has been prepared by mixing 100 units of regular insulin in 250 milliliters of 0.9% normal saline. Based on this information, the question is, how many milliliters per hour should the nurse set on the infusion pump? Be sure to round your answer to 1 decimal place. Here is the correct answer. 11.3 milliliters per hour. Now, let us break down the math in words. To determine the rate, we use the standard formula, desired dose divided by the total amount in the solution, then multiplied by the total volume. The prescribed dose is 4.5 units per hour, and the intravenous bag contains 100 units in 250 milliliters. So first, divide 4.5 by 100, which equals 0.045. Then multiply that by 250 milliliters, resulting in 11.25 milliliters per hour. After rounding to 1 decimal place, we get 11.3 milliliters per hour. Therefore, the nurse should set the infusion pump to deliver 11.3 milliliters per hour to ensure the client receives the correct insulin dosage. Let us now look at a public health scenario that requires quick nursing judgment. Question 31. A community health nurse is reviewing infectious disease cases to determine which one needs the most urgent follow-up. The options are: Option A, a food service worker diagnosed with hepatitis, A, currently working in a hospital cafeteria. Option B, a client on tuberculosis treatment who is still sputum positive after 2 months. Option C, a client with human immunodeficiency virus who has an undetectable viral load but reports unprotected sex. And Option D, a client with Lyme disease who stopped intravenous antibiotics due to nausea. The correct answer is Option A, a food handler with hepatitis, A, working in a hospital. This is an immediate public health concern because hepatitis A spreads through the fecal-oral route and poses a serious outbreak risk in healthcare settings. Therefore, active hepatitis A in a hospital food worker demands the most urgent public health response. Let us now turn to a pediatric assessment scenario 32 involving a 4-month-old infant. When measuring heart rate during a routine physical exam, which technique will provide the most accurate result? The options are: Option A, using a stethoscope to listen for 60 seconds over the 4th intercostal space at the mid-clavicular line. Option B, palpating over the 5th intercostal space, mid-clavicular line for 30 seconds. Option C, measuring the brachial pulse for 1 full minute. And Option D, assessing the radial pulse for 30 seconds while the infant is calm. The correct answer is Option A, using a stethoscope to listen for 60 seconds over the 4th intercostal space at the mid-clavicular line. In infants under 1 year of age, the most accurate method to assess heart rate is apical auscultation for a full minute, since rhythm irregularities such as sinus arrhythmia are common. The apical impulse in infants is located at the 4th intercostal space, not the 5th like in adults, and using a stethoscope ensures the most reliable reading. Question 33. Let us now explore a clinical scenario involving nutritional support for a burn client. When a client in the burn unit points to the total parenteral nutrition (TPN) bag and asks, "Why am I receiving this?" the nurse must respond with both accuracy and reassurance. The options are: Option A, "I'm not sure you should be on that. Let me contact your healthcare provider right away." Option B, "This is total parenteral nutrition, which is necessary because your burn injuries have increased your body's nutritional needs." Option C, "This is total parenteral nutrition, and you are getting it because you are not eating enough food." Option D, "You should not be getting that right now. I will go ahead and stop the infusion." The correct answer is Option B. This is total parenteral nutrition, which is necessary because your burn injuries have increased your body's nutritional needs. Burn injuries create a hypermetabolic state, increasing the body's need for nutrients. TPN provides essential calories and protein when oral intake is not enough, helping support healing and immune function. Now let us move into the obstetric realm with a case involving Rh incompatibility. Question 34. A. Client at 28 weeks gestation is found to be Rh negative during a routine prenatal visit. The options for preventing Rh alloimmunization are: Option A. Administer Rhd immune globulin around 28 weeks. Gestation. Option B. Schedule an early induction to reduce fetal exposure. Option C. Reinforce the need for continued folic acid supplementation. Option D. Advise the client to limit travel during the last trimester. The correct answer is Option A. Administer Rhd immune globulin around 28 weeks gestation. This injection prevents the mother's immune system from developing antibodies against Rh-positive fetal red blood cells. It is the gold standard for preventing Rh alloimmunization and its complications, such as hemolytic disease of the fetus and newborn. In summary, the administration of Rhd immune globulin is the essential preventive action for Rh-negative clients at 28 weeks gestation. Question 35. Let us now evaluate a key indicator of effective treatment in septic shock. The nurse is caring for a client with septic shock. The options to assess clinical improvement are: Option A. Mean arterial pressure of 67 millimeters of mercury. Option B. Urine output of 20 milliliters per hour. Option C. Capillary blood glucose level of 253 milligrams per deciliter. Option D. Arterial blood pH of 7.33. The correct answer is Option A. Mean arterial pressure of 67 millimeters of mercury. A mean arterial pressure of 65 or above indicates that organ perfusion is being maintained, which is a primary goal in managing septic shock. In short, maintaining a mean arterial pressure above 65 millimeters of mercury confirms that perfusion is improving and treatment is effective. Stop scrolling and listen up. This could change your NCLEX prep completely. We are offering free 5-day access to our most powerful NCLEX crash course. No payment, no tricks. Just click the WhatsApp link in the description and type, "Hi." That is all. We will give you live and recorded expert classes, real NCLEX-style practice questions, next-gen case studies, downloadable notes, and personalized study plans, all at zero cost. If you want to pass smarter and faster, this is your moment. Question 36. Let us move forward with another essential medication teaching scenario. A nurse is educating a client recently diagnosed with herpes zoster, or shingles, who has been prescribed oral acyclovir. Here are the options the nurse might consider. Option A. Take this medication on an empty stomach about 30 minutes before meals. Option B. Continue taking this medication until the rash completely goes away. Option C. If you miss a dose, take it together with your next scheduled dose. Option D. Make sure to increase your fluid intake while taking this medication. The correct answer is Option D. Make sure to increase your fluid intake while taking this medication. Acyclovir is eliminated through the kidneys, and increased hydration helps prevent kidney damage by reducing the risk of drug crystal accumulation. This is the most essential teaching point to reduce the risk of nephrotoxicity. To summarize, maintaining adequate hydration is the top nursing priority for safe acyclovir administration. Question 37. Let us move on to a pharmacology-focused scenario in anxiety management. A client with generalized anxiety disorder continues to have symptoms despite lifestyle changes. The nurse anticipates the provider may now start medication. The options are: Option A, venlafaxine; Option B, paroxetine; Option C, alprazolam; Option D, duloxetine. The correct answer is Option B, paroxetine. Paroxetine is a selective serotonin reuptake inhibitor, or SSRI, often used for long-term treatment of generalized anxiety disorder. It works by increasing serotonin in the brain, helping stabilize mood and anxiety. Selective serotonin reuptake inhibitors are preferred for long-term use due to their effectiveness and low risk of dependence. In summary, paroxetine is the best choice based on classification and safety for long-term GAD management. Question 38. Let us now explore child development through Erikson's lens. During a routine well visit, the nurse is assessing a 4-year-old child. According to Erickson's psychosocial theory, which developmental stage applies to this age group? Consider are the options. Option A, trust versus mistrust. Option B, initiative versus guilt. Option C, identity versus role, confusion. Option D, industry versus inferiority. The correct answer is option B, initiative versus guilt. In Erickson's theory, the preschool years, typically from 3 to 5 years old, represent the stage of initiative versus guilt. At this age, children begin to explore their world through play, imagination, and social interactions. When encouraged, they develop confidence and leadership. But if their initiative is overly restricted or criticized, they may feel guilty for asserting themselves. In summary, the initiative versus guilt stage best describes the social and emotional development of a 4-year-old child. Keep going. You are doing great. Question 39. Let us now move into infection control with a client who presents with generalized urticaria. Which type of precautions should the nurse implement in this case? Here are the options. Option A, airborne precautions. Option B, droplet precautions. Option C, contact precautions. Option D, standard precautions. The correct answer is option D, standard precautions. Urticaria is a non-infectious allergic reaction, so there is no risk of transmission. Standard precautions, such as hand hygiene and gloves when needed, are sufficient. No additional airborne, droplet, or contact precautions are required. In summary, standard precautions are all that is needed for a client with urticaria, since it is not contagious. Question 40. Let us shift to a common pediatric mental health concern, school phobia. A school-aged child has recently developed this issue, and the nurse is counseling the parents. Which parental response shows the best understanding? Here are the options. A, we will just wait until their fears wear off. Until then, we will just keep them home. Option B, teachers and counselors at school cannot possibly help them. Option C, we'll try not to talk to them about it too much. Option D, we will discuss some solutions with them together with a counselor. The correct answer is option D. We will discuss some solutions with them together with a counselor. This response promotes collaboration and emotional support, allowing the child to express fears in a safe space. Involving a counselor helps identify root causes, like bullying or anxiety, and build effective solutions through family and professional teamwork. In summary, early, open, and collaborative intervention is key to overcoming school phobia and supporting the child's emotional well-being. Question 41. Let us move into the realm of fall prevention for older adults, a critical area in client safety. The nurse is contributing to a fall prevention initiative. Which recommendation would be most effective in reducing fall risk in this population? The options are: Option A, increase access to bedside commodes for clients with limited mobility. Option B, request that an occupational therapist assess clients for mobility and safety. Option C, decrease nighttime lighting to reduce sensory overstimulation. Option D, remove assistive devices such as bathroom grab bars to prevent misuse. The correct answer is option A, increase access to bedside commodes for clients with limited mobility. This intervention directly reduces the distance clients need to walk for toileting, especially during nighttime or when urgent needs arise. It helps prevent unassisted ambulation, a common contributor to falls in hospitalized or immobile older adults. In summary, reducing fall risk involves practical, client-centered strategies like bedside commodes, proper lighting, and maintaining assistive devices. Question 42. Let us move into a key area of seizure management education. The nurse is teaching a client who has been newly prescribed phenytoin. Which client statement best shows correct understanding? The options are: Option A, if my gums become swollen or irritated, I should stop taking this medication. Option B, I will need to have my blood levels checked regularly while on this medication. Option C, if I have a seizure, I can increase the dose of this medication myself. Option D, I should take this medication only with low-protein meals. The correct answer is Option B, I will need to have my blood levels checked regularly while on this medication. Phenytoin requires regular serum monitoring due to its narrow therapeutic range of 10 to 20 micrograms per milliliter. Proper blood levels prevent seizures and avoid toxicity. Clinical pearls. Phenytoin. Toxicity causes ataxia, nystagmus, and confusion. Maintain dental hygiene to reduce gingival overgrowth. Therapeutic monitoring is essential to avoid underdosing or toxicity. Question 43. Let us now turn to a question about post-surgical positioning for a pediatric client. The nurse is caring for a child in the immediate post-operative period after a left-sided myringotomy with tympanostomy tube placement. Which position would best promote recovery and facilitate ear drainage? The options are Option A, left lateral position, Option B, prone position, Option C, right lateral position, and Option D, modified Trendelenburg position. The correct answer is Option A, left lateral position. Placing the child on the same side as the surgical ear uses gravity to aid in drainage, enhances comfort, and reduces the risk of fluid buildup or infection. Clinical pearls. Myringotomy is often done for chronic ear infections. Tympanostomy tubes help ventilate the middle ear. Parents should monitor for signs of infection and keep the ears dry. Tubes usually fall out on their own within several months. Question 44. Let us now look at a high-priority scenario involving contrast dye. A nurse is caring for a client undergoing cerebral angiography when the client says, "My throat feels itchy and my eyes are starting to water." The options are Option A, I feel nauseous and a little dizzy. Option B, I hope everything turns out okay with the scan. Option C, I feel a warm rush going down my body. And Option D, my throat feels itchy and my eyes are starting to water. The correct answer is Option D. My throat feels itchy and my eyes are starting to water. This suggests a possible early allergic reaction to contrast dye, potentially progressing to anaphylaxis. Immediate nursing action is required to assess the airway, stop the infusion, and prepare emergency medications. Here is why the other options are not the best choices. Question 45. Let us now explore how physical development typically unfolds in infants and young children. The nurse asks which pattern best describes this progression. The options are Option A, growth proceeds from the hands and feet inward toward the center of the body. Option B, growth advances from the central body outward toward the extremities. Option C, growth follows a head-to-toe pattern, starting with the head and progressing downward. And Option D, growth is most rapid initially in the legs and arms. The correct answer is Option C, growth follows a head-to-toe pattern, starting with the head and progressing downward. This cephalocaudal pattern means infants gain control of the head and upper body before mastering the trunk and legs, forming the foundation for motor milestones like sitting and walking. Let me coach you up for a second. If you are feeling stuck, overwhelmed, or just want a smarter way to prep, I got you. We are giving away 5 days of free access to the complete NCLEX crash course. Just click the WhatsApp link in the description and say, "Hi." That's simple. We will unlock live NCLEX review sessions, 5,000 plus practice questions, NGN case studies, checkmark PDF resources, and study plans that match your timeline. This is your chance to sharpen your game for free. Back to question number 46. This includes a case involving Guillain-Barré syndrome. During a neurological assessment, the nurse must identify the most expected clinical finding. The options are Option A, exaggerated deep tendon reflexes, hyperreflexia. Option B, repetitive verbal responses, perseveration. Option C, involuntary muscle contractions with abnormal posturing, dystonia. And Option D, tingling and numbness in the extremities, paresthesia. The correct answer is Option D, tingling and numbness in the extremities, paresthesia. This sensation is often the earliest sign of Guillain-Barré syndrome, reflecting peripheral nerve demyelination. It typically starts in the hands or feet and ascends symmetrically, often preceding muscle weakness or paralysis. Now, clinical pearls. Guillain-Barré syndrome begins with ascending weakness and paresthesia, with potential respiratory involvement. Triggers include infections and recent vaccines. Treatment includes intravenous immunoglobulin or plasmapheresis. Always monitor for respiratory decline using serial spirometry. Question 47. As we transition into another key post-operative scenario, let us discuss the most appropriate room preparation for a client recovering from a total thyroidectomy. The options are Option A, placing petroleum gauze and sterile water at the bedside. Option B, requesting a standing prescription for intravenous magnesium sulfate. Option C, setting up a tracheostomy tray, oxygen equipment, and suction at the bedside. And Option D, applying a cervical collar to stabilize the neck. The correct answer is Option C, setting up a tracheostomy tray, oxygen equipment, and suction at the bedside. This setup is crucial because airway obstruction from edema or hematoma is a life-threatening risk after thyroidectomy. Immediate access to airway equipment ensures rapid intervention if breathing difficulty occurs. Clinical pearls. After thyroidectomy, always prioritize airway safety. Keep suction, oxygen, and a tracheostomy tray at the bedside. Monitor for signs of bleeding, hypocalcemia, and voice changes. Let us move into a vital skill every nurse must master. Question 48, Abdominal Assessment Technique. The question asks which sequence the student nurse should follow when examining a client with gastroenteritis. The options are Option A, auscultation, inspection, palpation, percussion. Option B, inspection, palpation, percussion, auscultation. Option C, palpation, percussion, inspection, auscultation. And Option D, inspection, auscultation, percussion, palpation. The correct answer is Option D, inspection, auscultation, percussion, palpation. This is the standardized order for abdominal assessments because it prevents stimulation of bowel sounds before auscultation. You begin with inspection to observe the contour, symmetry, and skin changes. Auscultation follows before any manipulation, ensuring bowel sounds are not falsely altered. Then percussion helps identify underlying structures. And palpation comes last, especially over tender areas. Clinical pearls. Think, look, listen, tap, touch. To remember the correct sequence. Inspection, auscultation, percussion, palpation. Always assess painful areas. Last, listen to each quadrant for bowel sounds for up to 5 minutes if absent, and palpate gently to avoid worsening inflammation. This proper technique ensures accuracy and patient safety. Now shifting to dietary management for hyperlipidemia, the question 49 asks which client statement indicates the need for further teaching. The options are Option A, I should replace hydrogenated vegetable oils with canola oil when cooking. Option B, I should increase my intake of fish like tuna and salmon more often. Option C, increasing my fiber intake will help lower my cholesterol. And Option D, I am glad that I will not need to reduce red meat from my diet. The correct answer is Option D, I am glad that I will not need to reduce red meat from my diet. This statement reveals a misunderstanding, as red meats are high in saturated fats, which can raise low-density lipoprotein levels and increase cardiovascular risk. Clients with hyperlipidemia should be advised to reduce red meat intake to help lower cholesterol. Clinical pearls. To manage hyperlipidemia, effectively, limit saturated and trans fats. Opt for healthy fats like omega-3s, increase soluble fiber intake, and favor lean proteins over red meats. Reinforce that diet, exercise, and lifestyle changes all play vital roles in maintaining healthy cholesterol levels. Let us now focus on a critical safety concern related to metoclopramide. Question 50. The nurse is educating a client prescribe this medication for nausea and vomiting. The options are Option A, my neck feels stiff and I'm having trouble moving it. Option B, I have a fever that will not go down. Option C, I feel extremely sleepy after taking the medicine. And Option D, I have been having loose stools today. The correct answer is Option B, I have a fever that will not go down. This symptom suggests a possible early sign of neuroleptic malignant syndrome, NMS, a rare but life-threatening reaction requiring immediate action. The nurse must hold the medication, assess the client, and notify the healthcare provider urgently. Clinical pearls. Always monitor for NMS signs like fever, rigidity, and confusion. Avoid long-term use to reduce tardive dyskinesia risk. Administer 4 doses slowly. Avoid use in Parkinson's disease. And consider antihistamines to prevent dystonic reactions. Fever with rigidity demands immediate attention. Let us now review a high-priority home safety concern for clients on oxygen therapy. Question 51. The nurse is conducting a home assessment for a recently discharged client receiving continuous oxygen. The options are Option A, a functional smoke detector installed in the home. Option B, extra extension tubing for easier movement. Option C, slip-resistant mats placed in walking areas. And Option D, a portable room air humidifier. The correct answer is Option A, a functional smoke detector installed in the home. Oxygen increases the risk of fire by accelerating combustion. So having a working smoke detector is essential to detect early fire hazards and ensure timely response. As for the incorrect options, option B may help with mobility, but does not directly address fire safety. Option C is useful for fall prevention, but is not specific to oxygen-related risks. Option D may relieve dry air symptoms, but does not mitigate the critical fire danger associated with oxygen therapy. Clinical pearls. Oxygen safety starts with fire prevention. Ensure smoke detectors and fire extinguishers are present. Instruct clients to keep oxygen away from flames and heat sources, avoid petroleum-based products, and post no smoking signs. Tubing should be safely placed to avoid trip hazards and suffocation risks. Let us move into a critical post-operative scenario involving organ transplantation. Question 52. The nurse is caring for a client who is 48 hours post-liver transplant. The options are Option A, a mild temperature rise from 97.8 degrees Fahrenheit to 98.6 degrees Fahrenheit. Option B, a progressive elevation in aspartate aminotransferase and alanine aminotransferase laboratory values. Option C, the presence of moderate serosanguinous drainage at the surgical site. And option D, nausea occurring after administration of oral analgesics. The correct answer is option B, a progressive elevation in aspartate aminotransferase and alanine aminotransferase laboratory values. This finding is highly concerning because rising liver enzymes can signal early acute graft rejection, a serious complication that may occur within days after liver transplantation. Prompt recognition allows for timely adjustment of immunosuppressive therapy and can prevent irreversible organ damage. Clinical pearls. Acute liver rejection often begins with rising AST, ALT, bilirubin, or PT. Monitor for early symptoms like fever, RUQ pain, and jaundice. Trends in lab values are more informative than isolated results. Early reporting is key to preventing graft failure. Let us now shift to a high-priority scenario involving sudden respiratory distress. Question 53. A client in the medical surgical unit suddenly reports difficulty breathing. The options are Option A, remove pillows from under the client's head. Option B, raise the head of the client's bed to an upright position. Option C, elevate the foot end of the bed to promote circulation. And option D, measure the client's blood pressure to assess hemodynamic stability. The correct answer is option B, raise the head of the client's bed to an upright position. This action immediately promotes lung expansion by reducing pressure on the diaphragm and allowing for better air entry, making it the most effective and rapid first response to respiratory distress. Clinical pearls. Always prioritize airway and breathing using the ABC framework. Position changes are a fast, low-tech, and life-saving intervention for dyspnea. Documentation of respiratory effort and SpO2 is essential after intervention. Use the orthopneic or Fowler's position to relieve respiratory distress while preparing for further clinical actions. Let us now explore an essential concept in diabetes management involving insulin pumps. Question 54. A nurse is educating a client who has recently started using an insulin pump, and the client asks which type of insulin is typically used. The options are Option A, rapid-acting insulin, Option B, ultra-long-acting insulin, Option C, intermediate-acting insulin, and Option D, long-acting insulin. The correct answer is Option A, rapid-acting insulin. This is because insulin pumps are designed to closely mimic pancreatic function by delivering rapid-acting insulin, such as Lispro or Aspart, both continuously for basal coverage and in bolus doses around mealtimes for better glycemic control. Their quick onset and short duration make them ideal for real-time glucose adjustments. Clinical pearls. Insulin pumps rely on rapid-acting insulin for accurate meal dosing and better blood glucose control. Clients must be educated on carbohydrate counting, hypoglycemia signs, and troubleshooting pump malfunctions. Question 55. A nurse is assessing visual complaints in a client diagnosed with age-related macular degeneration. See the choices below. Here. Picture 1, Picture 2, Picture 3, Picture 4. The correct answer is option C, which shows central vision loss with preserved peripheral vision. This accurately reflects the typical visual disturbance seen in macular degeneration, where the macula, the part of the retina responsible for sharp central vision, is damaged. Clients often report blurry, distorted, or dark spots in the center of their vision, making tasks such as reading, driving, or recognizing faces difficult. While their peripheral vision remains intact, key clinical pearls for macular degeneration include understanding that central vision is affected first, and clients may benefit from using magnifiers, bright lighting, and large print materials. Regular ophthalmology visits and Amsler grid testing are vital for monitoring disease changes. Quick pause, take a breath, and let me help lighten your load. We are giving you free 5-day access to our complete NCLEX crash course. No sign-up hassles, no payment info needed. Just click the WhatsApp link and message, "Hi." That simple. We will unlock expert-led live sessions, 5,000 plus real NCLEX-style questions, NGN case walkthroughs, full PDF notes and guides, and study plans tailored just for you. Take this gift. Use it well. You are not alone on this journey. Let us move on to a skill-based question focused on safe catheter insertion technique. Question 56. While inserting a Foley catheter in an adult male client, when should the nurse appropriately inflate the retention balloon to ensure safe placement? Here are the options. A. When resistance is felt during insertion. B. Immediately after observing urinary flow. C. After advancing the catheter to the Y junction. Bifurcation. After inserting the catheter completely until it stops, the correct answer is option C. After advancing the catheter to the Y junction, bifurcation. This point marks where the drainage and balloon ports split, ensuring the balloon is fully inside the bladder. Inflating too early, especially in the urethra, can cause pain, trauma, or injury. Once inflated, the nurse should gently pull back until resistance is felt. Then advance slightly to secure placement. Clinical pearls. Male urethras are longer. Insert to the bifurcation. Confirm urine return, but do not rely on it alone. After inflation, retract slightly until resistance. Most catheter injuries happen from inflating the balloon too early. Stay alert during the procedure. Now, let us shift into vaccine education, an essential topic for both nurses and clients alike. Question 57. The nurse is preparing to lead a professional development seminar focused on immunization guidelines. Which statement should be included as accurate vaccine education? Here are the options. A. The MMR vaccine is recommended during the first trimester of pregnancy. B. The human papillomavirus vaccine helps lower the risk of cervical cancer. C. The influenza vaccine can be administered to infants as early as 3 months old. D. The herpes zoster vaccine is recommended for adults beginning at age 40. The correct answer is option B. The human papillomavirus vaccine helps lower the risk of cervical cancer. This vaccine is a major preventive tool against cervical cancer, particularly for strains 16 and 18 of HPV. It is recommended as early as age 9, ideally before any sexual activity begins, and has also been shown to reduce the risk of genital warts and other related cancers. Clinical pearls for immunization. The HPV vaccine is among the few vaccines proven to reduce cancer risk and benefits males by decreasing viral spread. Live vaccines like MMR, varicella, and intranasal influenza are avoided during pregnancy. Now let us look at a high-yield question involving maternal infections and fetal development. Question 58. While reviewing risk factors for congenital anomalies, the nurse caring for a pregnant client understands that which maternal infection is most strongly linked to the development of congenital heart defects in the fetus? The options are A. Parainfluenza, B. Adenovirus, C. Rubella, D. Measles. The correct answer is option C. Rubella. Rubella, or German measles, poses a serious risk in the first trimester when fetal organs are forming. Infection during this time may lead to congenital rubella syndrome, which includes heart defects like patent ductus arteriosus, along with deafness, cataracts, and developmental delays. Rubella immunity is always screened during pregnancy, and the MMR vaccine is given postpartum if needed. Clinical pearls. Rubella is a top NCLEX topic. Remember its triad: heart defects, cataracts, and deafness. First trimester exposure is most dangerous. MMR is a live vaccine and should be given after delivery if needed. Now here is a safety-focused question involving blood transfusion in a ventilated client. Question 59. The nurse is caring for a client on mechanical ventilation who is receiving 1 unit of packed red blood cells. Which of the following findings would most likely indicate a transfusion-related reaction? The options are A. Low pressure ventilator alarm, B. Increased blood glucose, C. Diminished lung sounds, D. Hemoglobinuria. The correct answer is option D. Hemoglobinuria. Reddish or tea-colored urine signals hemoglobinuria, a key sign of a hemolytic transfusion reaction. This occurs when red blood cells are destroyed, releasing hemoglobin that is excreted in the urine. It can lead to kidney damage or clotting issues. The nurse must stop the transfusion, maintain intravenous access with saline, alert the provider, and collect blood and urine samples. Clinical pearls: hemolytic reactions show fever, back pain, hypotension, and hemoglobinuria. Always stop the transfusion at the first sign. Know your types. Let us now tackle a critical care question involving spinal injuries and shock types. Question 60. The nurse is assessing a client suspected to be in neurogenic shock following a spinal cord injury. Which clinical finding would most strongly support this diagnosis? The options are A. Distended jugular veins, B. Bradycardia, C. Elevated body temperature, D. Decreased respiratory rate. The correct answer is option B. Bradycardia. Bradycardia is a key feature of neurogenic shock and helps differentiate it from other types of shock. This occurs due to loss of sympathetic tone from spinal cord injury, allowing unopposed parasympathetic activity to slow the heart rate. Vasodilation also causes hypotension, making the combination of low heart rate and low blood pressure a red flag in trauma patients. Clinical pearls: neurogenic shock usually follows injuries at or above T6. Unlike other shock types, it causes bradycardia instead of tachycardia. Now let us shift to a high-priority mental health emergency related to substance withdrawal. Question 61. A hospitalized client with a history of chronic alcoholism, hypertension, hyperlipidemia, and opioid use disorder presents disoriented, perspiring heavily, with anastagmus, coarse tremors, confusion, and visual hallucinations. The nurse suspects delirium tremens. Which medication should the nurse request a prescription for? The options are A. Diphenhydramine, B. Diazepam, C. Phenytoin, D. Clozapine. The correct answer is option B. Diazepam. These symptoms reflect delirium tremens, a severe and life-threatening form of alcohol withdrawal. Diazepam, a long-acting benzodiazepine, is the treatment of choice because it enhances gamma-aminobutyric acid, GABA, activity, calming the central nervous system, reducing seizure risk, and controlling autonomic symptoms like tremors, agitation, and hallucinations. Clinical pearls: delirium tremens is a medical emergency needing immediate benzodiazepines and cardiac monitoring. Diazepam and lorazepam are first line, with lorazepam preferred in clients with liver disease. Next, let us focus on dietary management for a hormonal imbalance involving calcium regulation. Question 62. A nurse is reviewing the dietary plan for a client recently diagnosed with hypoparathyroidism. Which of the following dietary modifications would be most appropriate to help manage this condition? The options are A. High-calorie, low-calcium diet, B. Low-calcium, low-phosphorus diet, C. High-phosphorus, low-calcium diet, D. High-calcium, low-phosphorus diet. The correct answer is option D. High-calcium, low-phosphorus diet. Hypoparathyroidism results in decreased parathyroid hormone, leading to low calcium and high phosphorus levels. A high calcium, low phosphorus diet helps restore balance, reducing symptoms like muscle cramps, tetany, and seizures. This dietary adjustment is essential to prevent complications from hypocalcemia. Clinical pearls: encourage calcium-rich foods like dairy, leafy greens, and fortified juices. Limit phosphorus sources like soft drinks, cheese, and processed meats. Watch for signs of hypocalcemia such as tingling, muscle spasms, or seizures. Let us now turn to an ethics and communication question involving client autonomy and advance directives. Question 63. A nurse is discussing advance directives with a client who appears concerned and asks, "What if I change my mind later about what I want?" What is the most appropriate nursing response? The options are A. Explain that the client would have to file a new witness document in order to make any changes. B. Discuss the need to be very sure about his preferences, as the living will is a binding legal document. C. Assure the client that he can change or revoke his advance directives at any time. D. Advise the client that changes cannot be made during this hospital stay. The correct answer is option C, assure the client that he can change or revoke his advance directives at any time. Advance directives are legal tools that support a client's right to decide about their future care. However, they are not permanent. As long as the client remains mentally competent, they can modify or revoke these directives at any time, verbally or in writing. The nurse should reassure the client of this flexibility and document any updates to the care team. Let us now focus on infection control, an essential skill for protecting vulnerable populations. Question 64. The nurse is caring for a hospitalized child diagnosed with varicella zoster, also known as chickenpox. Which transmission-based precautions should the nurse implement to prevent the spread of infection? The options are A. Droplet precautions, B. Airborne and contact precautions, C. Contact and droplet precautions, D. Contact precautions. The correct answer is option B. Airborne and contact precautions. Varicella spreads through both airborne particles and direct contact with fluid from the vesicles. Therefore, airborne and contact precautions must be used together. The child should be placed in a negative pressure room, and staff should wear an N95 respirator, gown, and gloves. These precautions stay in place until all lesions are crusted, marking the end of contagiousness. Clinical pearls. Varicella is contagious from 1 to 2 days before the rash until lesions crust. The incubation period is 10 to 21 days. Non-immune individuals may need the vaccine or immune globulin post-exposure. Always use gown, gloves, and N95 mask. Pregnant or immunocompromised staff should not care for clients with active varicella due to increased risk of complications. Now let us focus on emergency burn care, where airway takes top priority. Question 65. The nurse is caring for a client with full-thickness burns to the entire anterior and posterior torso. Which action should the nurse prioritize first? The options are A. Assess the client's respiratory status, B. Prepare an infusion of lactated Ringer's solution, C. Insert an indwelling urinary catheter, D. Obtain an accurate weight. The correct answer is option A. Assess the client's respiratory status. Airway assessment is the first priority in major burns, especially when the torso is involved. Inhalation injury from smoke or toxic gases can cause rapid airway swelling, so signs like hoarseness, facial burns, or carbonaceous sputum must be checked immediately. Early intubation may be needed before swelling worsens. Clinical pearls. Follow the ABCs. Airway always comes first in major burns. Suspect inhalation injury with facial or neck burns. Use the Parkland formula after airway protection. Aim for urine output of at least 0.5 milliliters per kilogram per hour to gauge perfusion. Time for a quick NCLEX upgrade. You can now grab free 5-day access to our complete NCLEX crash course. No payments, no card, just results. Click the WhatsApp link in the description and type "Hi." That is all it takes to unlock real NCLEX-style question banks, live and replay classes, NGN-style case studies, downloadable PDF notes, and flexible study plans for every timeline. This is your 5-day boost to NCLEX confidence. Do not miss it. Now let us turn to mental health care and the treatment of eating disorders. Question 66. The nurse is caring for a client newly diagnosed with anorexia nervosa on the mental health unit. Which intervention should be included in the client's plan of care? The options are A. Allow the client to pick out items on the menu. B. Obtain an order for the client to attend psychotherapy. C. Encourage the client to select their meal times. D. Obtain a prescription for fluoxetine. The correct answer is option B. Obtain an order for the client to attend psychotherapy. Psychotherapy, especially cognitive behavioral therapy, is the cornerstone of treatment for anorexia nervosa. It helps clients challenge distorted beliefs about food and body image while addressing the emotional roots of the disorder. Early referral supports recovery through a structured, multidisciplinary approach. Family involvement and education are also key. Medications are used cautiously and are never a substitute for psychotherapy. Now, let us shift to client prioritization, identifying which situation needs immediate attention. Question 67. The nurse has been made aware of the following client situations. Which client should the nurse assess first? The options are A. A client who recently received tissue plasminogen activator, TPA, and has oozing at the insertion site of the peripheral vascular access device, B. A client who has acute kidney injury and has voided 100 milliliters of urine in the past 6 hours, OC. A client who has pericarditis and is sitting upright in bed, leaning forward to relieve chest pain, D. A client who has an intractable migraine and has vomited twice in the past 2 hours. The correct answer is option A. A client who recently received tissue plasminogen activator and has oozing at the insertion site. TPA is a powerful thrombolytic that carries a high risk of bleeding. Even minor oozing may signal systemic bleeding or a developing coagulopathy. This client must be assessed immediately to prevent serious complications like hemorrhage or intracranial bleeding. Clinical tip: always prioritize signs of bleeding in clients on TPA, especially within the first 24 hours. Watch for oozing, neurologic changes, or signs of internal bleeding. Now let us focus on evaluating medication effectiveness, especially in endocrine disorders like SIADH. Question 68. The nurse is caring for a client prescribed tolvaptan for syndrome of inappropriate antidiuretic hormone secretion. Which of the following findings would best indicate that the medication is achieving its intended therapeutic effect? The options are A. Fasting blood glucose level of 100 milligrams per deciliter, B. Urine-specific gravity of 1.010, C. Total cholesterol level of 176 milligrams per deciliter, D. Blood urea. Nitrogen level of 5 milligrams per deciliter. The correct answer is option B, urine-specific gravity of 1.01. Tolvaptan promotes excretion of free water in SIADH, which helps normalize serum sodium and dilute concentrated urine. A urine-specific gravity of 1.010 shows improved water balance and indicates that the drug is working as intended. Now, let us shift to adolescent health and pregnancy, a sensitive and high-impact topic for education. Question 69. The nurse is preparing an educational session on adolescent pregnancy for a group of high school students. Which statement is most accurate and should be included in the teaching session? The options are A. Teen pregnancies typically have a low risk of medical complications. B. Adolescents often delay disclosing or even deny their pregnancy during early stages. C. The use of contraception among teenagers has significantly declined in recent years. D. Teen pregnancies are often intentional and used as a form of rebellion. The correct answer is option B. Adolescents often delay disclosing or even deny their pregnancy during early stages. Teenagers may hide or deny pregnancy out of fear, confusion, or lack of awareness. Emotional responses vary and may delay prenatal care, increasing risk for both mother and baby. Non-judgmental support and early intervention are key to better outcomes. Clinical pearls. Teens may delay acknowledging pregnancy, making early detection and supportive care critical. Provide empathy, privacy, and guidance. Next, let us review an important safety principle in managing hypothermia. Question 70. The nurse is caring for a client diagnosed with moderate hypothermia, who is receiving warmed intravenous fluids. Why is it important for the nurse to ensure that rewarming occurs gradually? The options are A. To prevent superficial thermal burns, B. To reduce the risk of ventricular fibrillation, C. To avoid worsening frostbite injuries, D. To prevent the onset of muscle spasms. The correct answer is option B. To reduce the risk of ventricular fibrillation. In moderate to severe hypothermia, the heart becomes highly irritable. Rapid rewarming may cause cold blood from the extremities to rush back to the heart, known as afterdrop, which can further lower core temperature and trigger life-threatening arrhythmias like ventricular fibrillation. Gradual rewarming protects cardiac stability. Clinical pearls. Use internal methods like warmed IV fluids and humidified oxygen for moderate hypothermia. Monitor for afterdrop and cardiac rhythm changes. Passive warming is used in mild cases, while severe cases need active internal methods. Now, let us focus on safe injection site selection for infants, a critical skill for pediatric care. Question 71. The nurse is preparing to administer an intramuscular vaccine to a 2-month-old infant. Based on the images provided, which site should the nurse select for the injection? Image 1, Image 2, Image 3, Image 4. The correct answer is option B, Image 2, vastus lateralis site. This site, located on the anterolateral thigh, is the safest and most recommended intramuscular site for infants under 12 months. It offers a large muscle mass, is easily accessible, and avoids major nerves or blood vessels, making it ideal for effective and safe vaccine delivery. Next, let us review a fundamental respiratory care concept involving chest tubes. Question 72. A client is diagnosed with a spontaneous pneumothorax, and the healthcare provider informs the nurse that a chest tube must be inserted. What is the best explanation the nurse can provide to the client to help them understand the purpose of the chest tube? The options are A. The tube will prevent you from having chest pains. B. The tube will remove excess air from your chest. C. The tube controls the amount of air that enters your chest. D. The tube will seal the hole in your lung. The correct answer is option B. The tube will remove excess air from your chest. In a spontaneous pneumothorax, air collects in the pleural space, preventing lung expansion. The chest tube works by removing this trapped air, restoring negative pressure, and allowing the lung to re-expand properly. This is the clearest and most accurate explanation for the client. Let us now turn to health promotion and community education, specifically, how to prevent chronic obstructive pulmonary disease. Question 73. The nurse is conducting a health promotion session in a community center about the prevention of COPD. Which of the following should the nurse emphasize as the most significant risk factor for developing COPD? The options are A. Environmental pollution. B. Endobronchial infections. C. Cigarette smoking. D. Reactive airway disease. The correct answer is option C. Cigarette smoking. Cigarette smoking is the leading and most preventable cause of COPD. It damages airway structures, destroys elastin, and leads to chronic inflammation and emphysematous changes. Up to 90% of COPD cases are directly linked to smoking, making it the key target for prevention efforts. Clinical pearls: COPD is a progressive lung disease most often caused by smoking. Smoking cessation programs, pharmacologic aids, and public education are essential to prevention. To wrap up, let us finish with a medication calculation question involving pediatric dosing, one you will often encounter in clinical practice. Question 74. The primary healthcare provider prescribes ondansetron at 0.15 milligrams per kilogram intravenously to a pediatric client who weighs 18.18 kilograms or 39.99 pounds. The medication label reads 2 milligrams per milliliter. How many milliliters should the nurse administer to the client? Round your final answer to one decimal place. The correct answer is 1.4 milliliters. Here is the step-by-step calculation in words. First, multiply the prescribed dose, 0.15 milligrams per kilogram, by the child's weight of 18.18 kilograms. That gives a total dose of 2.727 milligrams. Next, use the standard formula. Dose ordered divided by dose on hand, multiplied by the volume available. That means 2.727 milligrams divided by 2 milligrams per milliliter, multiplied by 1 milliliter. This equals 1.3635 milliliters. Finally, round the result to one decimal place. 1.36 rounds to 1.4 milliliters. Clinical tip: always calculate pediatric doses based on weight and use precision tools like small syringes for intravenous administration.